Hello, everyone. Welcome back. I'm Steve,
And I'm Scott.
and together we are Backyard Musings, broadcasting from Apple Valley, California, the Science and Technology Channel.
Yeah.
We now have 417,000 subscribers. 417. Sorry, 417.
We would love to have 417,000 subscribers, but the 417 that we've got are good.
It's proven to be. It's interesting.
It's a lot of fun.
It is interesting, the science and technology.
And we have a local person that we know of, right? Somebody that you said from Asperia.
Yeah. Plus, the other people from church, President Hume, and President Wheeler.
Yeah. We got a few followers, but I don't know how often they listen, but subscribers. But to know that we got somebody from Asperia, that's fun.
Yeah. Diagnosing ALS. ALS, you were talking. That's Lou Gehrig's disease.
Yeah.
Is a challenge. But new research has found a highly effective way to detect and track the disease using blood biomarkers. The study compared 3 types of biomarkers and found that neurofilament light chain proteins stood out as the most reliable indicator, successfully identifying ALS more than 80% of the time. It also helped predict patient survival, offering crucial information for both patients and doctors. The findings were published February 26th of this year in Neurology, the medical journal of the American Academy of Neurology. Would you like to know more?
It's a tough disease, right? No cure.
It is.
No cure for this.
Debilitating, too.
Yeah. ALS, or amyotrophic lateral sclerosis, is often challenging to diagnose, and its progression can be difficult to predict. A new study has identified the most effective blood test for detecting and monitoring ALS, offering a potential breakthrough in diagnosis and disease tracking. Quote, having an effective biomarker can be highly valuable in addition to helping in making the diagnosis. It can help in predicting prognosis, evaluating what stage of the disease people are in, and tracking their progress or their response to treatments. And that's from the study author Sylvain Lehmann, who's a medical doctor and also PhD of the INSERM Hospital and University of Montpellier in France.
Sylvain sounds like a werewolf's name, doesn't it?
Yeah. I don't
know. You think he's a werewolf in France?
No. France? Were they famous for their
American Werewolf in London?
Right? Is it where's that Transylvania?
American Werewolf in Paris.
Oh, I don't know.
Okay. All right.
A little sidebar. Is that where you're going?
Yeah, but blood would be like vampires. Yeah. All right. The study compared 3 types of blood biomarkers: neurofilament light chain proteins, glial acidic proteins, and phosphorylated tau 181. Neurofilament light chain proteins can be detected in the blood when nerve cells are injured or die. Glial acidic proteins are released when cells work to repair injury. Phosphorylated tau 181 is linked to the buildup of amyloid proteins in the body. Man, this is way over my head.
Yeah, I don't know what half this stuff is.
Which occurs in Alzheimer's disease. For the neurofilament light chain proteins, researchers were also testing 4 techniques for measuring the levels.
The study involved 139 people who had ALS and 70 who did not have ALS but had similar diseases such as lower motor neuron disease and primary lateral sclerosis.
I think that's a decent size for this disease. It's not prevalent.
Okay. Researchers tested their blood using 3 types of biomarkers. They then followed the participants for an average of 3.5 years for the people with ALS and about 12 years for people who did not have ALS. During that time, 86% of the people with ALS died.
Ooh.
Well, that's the outcome, right?
Yeah.
Body kind of falls apart compared to 8% of the people with other diseases. So, tough.
Yeah, for neurofilament light chain proteins, the people with ALS had levels in their blood 3 times higher than the people with other diseases. The study found that the neurofilament light chain tests correctly identified the people with ALS more than 80% of the time. That's good. The accuracy of diagnosis for the glial acidic protein and phosphorylated tau 181 test was poor, with accurate results around 50% of the time. We'll flip a coin.
Yeah. The researchers also identified a level of neurofilament light chain protein that can help predict survival for people with ALS. Within a year, more than 40% of the people with protein levels below that point were still alive. That's pretty good.
Yeah.
While none of the people with levels above that point were still alive. Quote, while more research needs to be done to confirm these findings, having better information about prognosis is valuable for people with ALS and their families, as well as doctors who treat them. And that's according to Dr. Lyman. Limitation of the study was that all the participants were from the same area of France, so those results may not apply to people from other areas, but I don't see why they wouldn't.
I wonder if it's something in the wine, because they all have cheese and wine, right?
Yeah, I don't know. I mean, the only person that I'm sure there's a lot of people that have had it, but Lou Gehrig obviously was a famous guy, and he kind of brought it to the forefront, right? He was a famous baseball player, right?
Yeah.
And just went downhill after, he retired from it, and then retired from baseball, and then was in a wheelchair for a while, and then finally, body just deteriorated and died. Yeah, it was a sad deal. I don't know. But yeah, this sounds promising, so hopefully they'll keep up with it. So, hey, speaking of, while we're on, did anybody see the planet alignment last night? I missed it.
I did not.
I know I missed it too. That's terrible.
Yeah, I got jammed up. The elders came over for dinner.
I wonder if you can still see it tonight.
Maybe. I don't know. Tonight, but it is kind of cloudy.
Yeah. Well, maybe check it out. Let us know if you saw it.
Yeah, let us know if you saw it. Definitely. We want to know.
Yeah.
All right, folks. Thanks for joining us. We'll catch you in the morning.
Take care, everyone. Thanks.